The statistics are staggering. 1 in 2 women and 1 in 3 men will be diagnosed with cancer in their lifetime. Although the incidence of cancer is on the rise, there is tremendous hope for better survival and quality of life because of cutting-edge research and newer treatment. According to the World Health Organization, 1/3 of cancers are preventable through lifestyle choices. We should have a balanced diet, exercise often, and maintain a healthy weight, limit intake of alcohol and red meat, and never smoke. Although the danger of cancer exists, precision medicine is transforming the way some cancers are treated today, providing a ray of hope for these patients. In this episode of Let's Talk Health, let's look at some more facts about cancer and the advances in diagnosis and treatment.
Cancer is possibly one of the most dreaded diseases across the world. The very mention of the word cancer strikes fear in most of us. It's a disease that comes without warning, and what causes is not well defined.
All the cells which are in the body, at some point they are supposed to, are programmed to die at some time. When the cells lose that ability to die, they keep on dividing and growing further. So there is an uncontrolled growth of cells which occupy the normal cells and eventually lead to normal cells not able to grow and functions being affected. That is cancer. And the reason why somebody gets a cancer, what causes cancer, still nobody really is able to pinpoint as this is the cause. But there are like multiple reasons, all the way from environment to the food habits to viral infections, and also like exposure to some carcinogens, smoking, tobacco, alcohol, all of them lead to cancer.
Cancer is usually curable if diagnosed and treated in the early stages. However, if a patient misses the early symptoms, it can result in a late diagnosis, making treatment more difficult.
It is a conquerable disease if it is diagnosed early, but unfortunately, a lot of cancers are not diagnosed early. Partly because that some of them have very minimal symptoms, where people don't have any symptoms, so they don't go to the doctor. And sometimes it is the symptom which is very minor, either missed out by the patient or even by the physicians, so that the diagnosis is getting delayed. So in those situations, it gets very difficult to treat.
Treatment options depend on the type of cancer, the stage it is in, and the spread of the disease. The 3 main treatments are surgery. It plays a pivotal role in removing the tumor. Chemotherapy is a drug treatment that uses powerful chemicals to kill the fast-growing cells in the body. Radiation treatment is the use of precisely calculated doses of X-rays to treat the parts of the body where cancer has spread.
Surgery, if it is confined to one tiny area, or if it's a very small tumor, primary modality will be like surgery and removing it completely. The second thing is going to be the chemotherapy, which is like giving medications either through the IV or by oral tablets, which will kill the cancer cells and also reduce the spread of cancer. Third one is the radiation, which is given to the particular point to kill those cancer cells. So those are the 3 main modalities of cancer treatment.
In this episode, we look at the stories of 2 brave hearts that battled the disease to emerge as cancer survivors. This 2-year-old loves cars and racing. Come weekend and he gets to play with his father. The father too cherishes this time with his toddler. But life wasn't always this picture perfect for Amitabh Ghosh. A professor with IIT Madras, Amitava has just become a father when he was diagnosed with esophageal cancer.
In 2013 May, I was just eating out in a restaurant, and after taking the food while coming out, we were just going towards the shopping complex. I was just sharing with my wife, see, this time I had a very strange feeling within the stomach, and this kind of feeling I never felt before. It is not really bothering, but it is something different. We decided a date, we fixed up an appointment with the doctor, and the endoscopy was done. The result was not very much encouraging at the end of the examination. He found there is a lesion at the gastroesophageal junction, which does not look to be very friendly.
He actually broke down on day one because his major concern was like one for him. The second major thing for him was the family. With recently being married and the wife being pregnant, his major concern was like, suppose if he does not live, what is going to happen to the family? The major part of our treatment is not only the treatment part, which is relatively easy in the sense, but to go through the psychological part of it.
Esophageal cancer occurs when the cancer cells develop in the esophagus. Esophagus is the tube through which the food passes from the throat to the stomach. Eventually, a lump forms in the wall of the esophagus as the tumor grows. One may not have any symptom in the early stages of esophageal cancer, but later one may get discomfort while swallowing food as the tumor becomes large and blocks a part of the esophagus. It may also create trouble in eating, resulting in sudden weight loss. The cancer had affected Amitava's lower esophagus, extending deep into the stomach. The treatment was tailored to his health condition, and so it began with the sessions of chemotherapy and radiation therapy.
I had a very fearful idea about the chemotherapy. I was thinking a lot of injections, possibly it would be torture. But chemotherapy treatment, as a mode of treatment, it is very simple. It is just like giving a saline, administering the medicine through the vein. So procedure is very simple, but the effect is, of course, it is you have to be at the side effects of the chemotherapy. So initial 2 weeks it was not, I was feeling weaker. My body started feeling weaker, but it was not that much difficult. Even I was going around talking with my family members quite freely.
After some sessions of chemo and radiation therapy, Amitava became a safe candidate to go ahead with the surgery. During the surgery, a large part of the esophagus that contained the tumor was removed, along with some normal tissues above and below it. Some or most part of the stomach is also removed depending upon the severity of the cancer. The remaining healthy part of the esophagus and stomach is attached to each other. It may also involve removing the nearby lymph nodes if the cancer has spread to them.
When my senses first came back, the doctors asked me, Dr. Ghosh, you are absolutely okay, the surgery is finished, it has been done very well. And what was my first response? That did you keep my full stomach or is it completely removed? And that was in the operation, immediately after the operation, when my senses came back. I think the doctor understood that the brain of the patient is working absolutely fantastic, nothing to worry about.
We tell them to eat and drink frequently. It is easy to say, but it's very difficult to do. So people tend losing weight, and in fact he did lose a lot of weight post surgery for almost like 1.5 years, and then the weight kind of stabilized, and now he is slowly picking up the weight. It's not an easy thing. You feel like eating, but you're not able to eat. And that is the kind of feeling, it is very, very difficult. And that's one of the reasons why people even suggest like chemo radiation first. Because post-surgery, when they start losing weight, if you give an aggressive treatment of chemo and radiation, it gets very difficult for them to tolerate that. That's one of the reasons why people have shifted the other way around. What we have suggested to him at this time is have a healthy food style, like reducing the spicy food, and more of reducing the salt and the pickles, and having a healthy lifestyle. That's the only thing we have recommended. Otherwise, he really doesn't have any do's and don'ts, but healthy habits.
Amitabha had a remarkably swift recovery ever since he was operated upon successfully. The follow-up consultation with the doctor hasn't shown any traces of cancer. Today, as Amitabha is back to leading a normal life, he doesn't seem to mind the diet limitations that come along with the post-operative care.
I'm very much happy because my entire quantity of the food is broken into number of pieces. My wife is quite concerned that okay, I should take good nutritious food, and he makes delicious foods and several varieties I get because I have to take several times a day. But I must say, yes, it's not a very concern. One thing is that I must say that you must accept that something has happened, something major thing has happened to me in my life, and a compromise is necessary. But it is painful if you don't accept. If you accept, yeah, you have made whatever the changes have taken place to you. If you accept it, the pain is less.
A cancer diagnosis doesn't mean an end of life. Like Amitabha Ghosh, all cancer patients can keep a positive frame of mind while battling the disease. It helps to not just survive the disease, but also lead a fulfilling life. Aarti was diagnosed with breast cancer when she was least expecting it. Her positive frame of mind helped her beat the disease and become a stronger person. Her powerful story after the break.